Abdominal wall and stomach. Dr. Nimir. Dr. Safa'a. Objectives: define the abdominal wall. Enlist the layers. Give its blood and nerve supply. Applied anatomy. Discuss stomach in terms of its parts and musculature. Enlist the peritoneal relations of the stomach. Enlist the structures forming stomach bed. Discuss the blood supply of the stomach. Abdominal wall divided into anterior lateral abdominal wall, anterior wall, right lateral wall, right flank, left lateral wall, left flank, posterior abdominal wall, anterolateral abdominal wall. This extended from the thoracic cage to the pelvis and bounded superiorly 7th through 10th costal cartilages and inguinal process. Inferiorly, inguinal ligaments and the pelvic bones. The wall consists of skin, subcutaneous tissues, fat, muscles, deep fascia and parietal peritoneum. Anterolateral abdominal wall fascia and subcutaneous tissues. The subcutaneous tissues over most of the wall consists of layer of connective tissues that contains a variable amount of fat. In the inferior part of the wall, the subcutaneous tissue is composed of two layers. Fatty superficial layer, Camper's fascia. Membranous deep layer, Scarpa's fascia, anterolateral abdominal wall muscles. 3 flat muscles with strong sheet-like aponeuroses. External oblique, internal oblique, transversus abdominis. 2 vertical muscles, rectus abdominis, pyramidalis. Anterolateral abdominal wall nerves. T7, T11 thoracoabdominal nerves. T12 subcostal nerve. L1 iliohypogastric nerve, ilioinguinal nerves. Anterolateral abdominal wall arteries. Internal thoracic artery. Superior epigastric artery. External iliac artery. Inferior epigastric artery. Deep circumflex iliac artery. Femoral artery. Superficial epigastric artery. Superficial circumflex artery. Applied anatomy. Abdomen is divided into 9 regions via 4 planes. 2 horizontal, subcostal, 10th, and transtuberculous plane, L5. 2 vertical, midclavicular planes. They help in localization of abdominal signs and symptoms. The 9 abdominal regions. Anterior abdominal wall functions. Form strong expandable support. Protect the abdominal viscera from injuries such as low blow in boxing. Compress the abdominal content. Helps to maintain or increase the intra-abdominal pressure. Move the trunk and help to maintain posture. Protuberance of the abdomen. The 5 common causes, 5F. Fat, feces, fetus, flatus and fluid. Abdominal hernias. Anterior lateral abdominal wall may be the site of hernias. Inguinal, umbilical and epigastric regions. Posterior abdominal wall. Lumbar vertebrae and 4 discs. Muscles. Psoas, quadratus lumborum, iliacus, transverse, abdominal wall oblique muscles. Lumbar plexus. Ventral rami of lumbar spinal nerves. Fascia. Diaphragm. Contributing to the superior part of the posterior wall. Fat, nerves, vessels, IVC, aorta, and lymph nodes. Posterior abdominal wall fascia. Between the parietal peritoneum and the muscles. The psoas fascia or psoas sheath. The quadratus lumborum fascia. The thoracolumbar fascia. Posterior abdominal wall muscles. 3 paired muscles. Psoas major. Iliacus. Quadratus lumborum, posterior abdominal wall nerves. The subcostal nerves. The lumbar nerves. The lumbar plexus of nerves branchus are: A. The obturator nerves, L2, L4. B. The femoral nerves, L2, through L4. C. Ilioinguinal and iliohypogastric nerves, L1. D. Gentiofemoral, L1, L2. E. Lateral femoral cutaneous nerves, L2, L3, posterior abdominal wall blood vessels. Aorta and its branches. IVC and its tributaries. Applied anatomy: posterior abdominal pain. Iliopsoas has relationship to kidney, ureters, cecum, appendix, colon, pancreas. Etc. When any of these structures is diseased, movement of the iliopsoas usually causes pain. When intra-abdominal inflammation is suspected, the iliopsoas test performed by moving iliopsoas muscle, and if positive it causes pain. Psoas abscess. Hematogenous spread to the lumbar vertebrae may form an abscess which may spread from the vertebrae into the psoas sheath, producing a psoas abscess. Stomach. The muscular wall. The outer longitudinal layer. The intermediate circular layer. The innermost oblique layer. Stomach musculature. Mucous membrane. Ruggy. Stomach. Stomach bed, transverse colon, transverse mesocolon, pancreas. Spleen and splenic artery. Left kidney. Left suprarenal. Left crus of the diaphragm. Arterial supply of the stomach. Venous drainage. Arteries of the stomach. Left and right gastric. Left and right gastroepiploic. And the short gastric arteries. Veins of the stomach. Left and right gastric. Veins, greater than portal vein. Left gastroepiploic and the short gastric veins. Greater than splenic vein. The right gastroepiploic vein, greater than superior mesenteric vein. Thank you.